Hello, my name is Vince Stiller, and I'm doing a report on preventing workplace violence within the healthcare setting. The objectives for this presentation is that the learner will be able to identify signs and symptoms of workplace violence, summarize strategies in preventing workplace violence, and explain how to respond to workplace violence once it occurs. What exactly is workplace violence? Workplace violence is any act occurring at work, whether it's physical assault from slapping, hitting, and kicking, to verbal threats, written threats, threatening actions such as waving fists, throwing objects, and violent assaults, which include attacks with weapons, homicide, and rape. Now, incidents within the healthcare setting, aside from law enforcement, the healthcare setting has the highest rate compared to other workplaces. OSHA put out a report stating that out of 10,000 employees, there were 7.88 cases where employees had to take off to recuperate from workplace violence, compared to less than 2 cases per 10,000 employees at other workplaces. 100% of emergency department nurses have been verbally assaulted, which is a staggering number. Hospitals were once a safe haven, however not anymore, and so there's been an increase in violent acts occurring within the walls of the hospital. It's been reported that between 2011 and 13, 75% workplace assaults occurred in the healthcare setting. 21% of nurses have been physically assaulted, over 50% verbally assaulted, and 80% of perpetrators were patients. Targets versus perpetrator. Anybody can be a target, whether you're a staff member, physician, a patient, family member. One important thing to realize and look out for is horizontal violence. This is bullying and incivility between two co-workers. It could be like silent treatment, sarcastic remarks, verbal abuse, sexual harassment. Horizontal violence is real and should not be tolerated. I had a previous coworker who called their another coworker after work and threatened that coworker. It was immediately reported to the manager and handled appropriately. The person was suspended for a few days, and also their clinical ladder pay was taken away from them. Even doctors are targets. There is a surgeon at Brigham and Women's Hospital who was shot dead by the son of a deceased patient in 2015. And anybody can be perpetrators, patients, family, friends. As I stated before, 80% of the perpetrators have been patients. Factors contributing to violence. Hospitals have an open door policy. Most of the time, those doors do not have metal detectors, so people can bring in weapons. There's patients with altered level of consciousness, whether it's dementia or substance abuse. Now, understaffed, gang violence that goes from the streets and comes into the hospital. Family stress, long waiting times for procedures, poorly lit areas, absence of security, and psychiatric units. Staff at psychiatric facilities report a 99% have been verbally abused, and 70% have been physically assaulted, which is a staggering number. And consequences of violence. Main one is injury, whether it's physical, emotional, psychological. It's financially costly, that the hospitals will possibly have to pay for the required treatment for the violent assault. Nurses may leave, therefore leaving managers to hire new staff, which is costly because they have to recruit, interview, orient, and train. There's a decrease in staff morale, increase of staff stress, caregiver fatigue and stress can lead to medication errors and possible patient infections. And just a mistrust of administration, just not trusting that administration will follow through with the appropriate interventions and policies that are in place. And preventing the violence. There should be a zero tolerance for any violent acts. That the person's situation must be dealt with immediately, and appropriate authorities are to be contacted. And also, enforcement of policies are to be done by management. If they're good friends with a staff member that was participating in horizontal violence or bullying, zero tolerance, and the policies trump any friendship, and the situation should be handled immediately. Staff education, so signs of violence and traits of perpetrators or increased escalating situations, such as people clenching their fists, blank stares, advancing towards someone, arms raised up in a fighting stance, and also education on how to de-escalate situations, which I will speak about later. Appropriate policies on how to report incidents and who to go to, environmental safety, adequate lighting, security, bullet-resistant barriers, and emergency department, curved mirrors, escort safety, adequate safety, and restraints. Area Jefferson Hospital saw a 55% reduction in workplace violence per JCAHO after implementing new interventions consisting of environment policies, technology and equipment, and communication. There's also been a lack of reporting of violence. Per Phillips, only 30% of violence or workplace violence within the healthcare is reported because there's either no policy in place, lack of faith in the policy, fear of retaliation from either the staff member or the patient or the family. And then also many people believe that violence is just part of their job and believe that the patient isn't at fault, whether the patient has dementia or substance abuse and they're unable to control their actions. I had a patient once who was withdrawing from alcohol. I had him, out of 5 nights, I had him 4 nights. And he was violently restrained, like he had the violent restraints on his wrists and his feet. He had a vest on as well. Prior to my shift, he had recently kicked a sitter. He had to go down to the ED, and the sitter was also peed on by the patient. And this patient would look at me and make the sound like the sound of a bullet coming out of a gun, and he would wink at me and just say, "You're dead." So that was a verbal assault from the patient, but security was already involved. They rounded frequently just to make sure that that his actions were at bay. But also, I don't know if I would have reported that, just because I don't know if the patient was at fault. I don't quite know what to do in that situation. Yeah, I can tell management about the situation, but I don't know exactly what they will do to help out. So I'm kind of in that boat as well, that I have a lack of faith in the policy because I'm just not sure what benefit there is in reporting it. What to do when violence occurs. If it's a non-violent situation, remember your non-verbal communication skills. Watch your body language. Keep a distance. When you speak, use clear, concise words. Speak in a calm tone, a normal voice, a slow rate. If it's a violent situation, make sure you are able to recognize the signs of escalating violence and call security and management right away. Never try to disarm a person, but if you're able to get them restrained, you may need to get some other staff in with you to help restrain the person. And it's also important to follow up. Everyone involved is affected. I think it's supposed to be affected with an A. My mistake. Safety is paramount for for all. Immediate treatment is to be done for any injuries that have occurred, completed incident report, and also possible police involvement if necessary. Per Sullivan, 94% of emergency department nurses had one symptom of PTSD following an incident of violence, and 17% were possibly diagnosed with PTSD, which is a significant amount, and follow-up with those people is paramount, just to make sure they're getting the proper treatment and the proper care after such an event. CPI is Crisis Prevention Institute. They have 10 de-escalation tips. I'll just state a few, such as using non-threatening, nonverbal communication, avoid overacting, focus on the feelings of the person, be non-judgmental, ignore challenging questions. So you can go to that website and look at the top 10 tips for de-escalating a situation. And here's a video here on how to properly apply restraints. It's a link that'll help teach you how to apply wrist restraints and vest restraints. And here are the references that I used for my project. Hope you enjoyed this project and have learned some on workplace violence. Have a good day.